So a lot of people have made a very big mistake because they have been running agency shift in a nursing home. There were so many things they didn't know before they jumped into it. So that is what we are going to be discussing today. Hello and welcome back to the channel. If you're seeing me for the first time, my name is Chidinma. So consider subscribing to the channel because here we talk nursing, vlog, lifestyle, migrant stories, and all the pretty good stuff happening in the United Kingdom. And if you're a returning subscriber, as always, I love you. Thank you for coming around. So without wasting so much of our time, let's go right into the video. The information I'm about to put out is my own perspective as somebody working in the nursing home, right? When you come to the United Kingdom, a lot of nurses who work in the hospital setting in particular, don't get me wrong, that is not to say that they don't know what they're doing, but a lot of them think that it is pretty easy to go into the nursing home and pick shifts. And before you know it, a lot of mistakes are done. On the other hand, a lot of nurses who are also working in the nursing home think that, oh, because I've been working in the nursing home, I can do it. You hop from one nursing home to the other, doing agency shifts, and eventually you find yourself in trouble. So before you pick any shift, especially if you're an overseas nurse in United Kingdom as an agency in a nursing home, make sure that you have gotten a proper induction about that very home you are going to. Say, for instance, you are working in the trust and you're going to the nursing home, right? The fact that you have done an induction in one nursing home and done a shift there does not guarantee that you are going to perform in another nursing home. So what's my point here? If you pick up a shift to go to a nursing home and you're coming from the hospital, particularly as an overseas staff, make sure you get a proper induction. Ask questions. Ask serious questions. When I mean ask questions, that is your goal. Understand the policy of the nursing home you are going into. Because if you make a mistake in that shift, nobody cares where you're coming from. What matters is that you're a qualified nurse registered to practice in the United Kingdom and they are going to take it on you. Because different workplaces, different nursing homes have different policies, have different guidelines on protocols that needs to be followed regarding a particular event, you need to get yourself acquainted to it. Just so that you know exactly what you're going to be doing. Because night shift in the nursing home, I used to call it a drama shift. Don't get me wrong, the day shift is full of drama, but the night shift will always have a bigger drama. So your chances of stumbling into events or incidences that are critical is on the high side. Hence the reason you need to make sure you have gotten your induction. Don't just pick the shift, walk into the home, feel confident because you're practicing in your previous place, in your permanent job in a nursing home, you're practicing in the hospital and think that it's that easy. If you go in there with that morale, the problem that will come from it, you would not believe it. That is number one. Ensure you have proper induction and understand the policy of the place you're going to. Number two, see, anybody watching this video, if you are a nurse practicing in the UK, you understand what I'm trying to say. Some, not all, some agency staff have this I don't care attitude because it's not their permanent place of work, especially some of the overseas staff. Without missing a word, without being apologetic about it, I'm telling you from experience, I've encountered so many. They feel that if any drama come up, because they are agency, they'll say, oh, it's agency. Eh? Take that from your head off. Anybody that is tutoring you that if you go into a particular shift anywhere, be it even the nursing home or the hospital, and drama comes out, you will not be called because you are agency. They don't love you. They are giving you the worst advice of the century. Put it at the back of your mind. If you know what is expected of you as a nurse in your full-time job, pick that agency shift and go in there and do the same. Never you display I don't care attitude. Never you say, oh, because I'm agency. Because by the time the managers come in the morning and they check everything and you have missed anything, they will start from calling your agency to contact you. They can set up a disciplinary action against you. They can write to NMC about you because at the end of the day, you are a nurse. And whatever you have omitted, if it's not a core policy issue and it is referred to as a cardinal thing for every nurse to know, and you think it's because you're agency, your pin will go. I'm telling you, I'm not even joking about this particular point. Your pin will go. So if you walk into the nursing home to do an agency shift, remove it from the back of your mind that your agency, what you're going there to do is medication. Some people, I've seen many of them, you hear them say, oh, what is my business? It's just to go and do medication and make sure all the residents are fine, and then the money clock off and go. My dear, death case can come for you. Emergency case can come for you. Anything can come for you during that night shift. Because most people that even pick agency shift in the nursing home, they prefer to pick night. They feel that a lot of drama happens during the day. But if you ask me, if you want to understand that setting where you are, the best shift is day shift, because that is where you might be paired up with a permanent staff. The managers are there, the clinical lead is there. If anything is going on, you understand what's going on. All the policies and stuff, you understand what is going on. So don't even bring this attitude of I don't care in an agency job. If you are going into the nursing home to do an agency shift, put in your best of your best. Just look at it that, see my pino, be putting it in your head, because there are certain things you might do in that shift or certain negligence that might occur, and the managers in question will not pardon you for it, regardless of agency or no agency. So that is that. Another thing that you must bear in mind when picking agency shift is, it is not advisable. You've just come into the UK, you're just barely 1 year old, and then you pick shifts in 20 nursing homes. Within 1 year, you have worked in 20. You're not doing yourself good, because at the end of the day, you will land yourself into trouble. The people who are wise, what they do is stick to some particular nursing homes, understand the way those nursing homes operate, understand the system, get acquainted with the staff, the policies, the protocol. They only pick shifts that come from those particular nursing homes because those are familiar environments to them. Yes. So I will advise you, if you're picking agency shift in a nursing home, make sure you stick to certain nursing homes, the ones you have confidence to work in. Don't just grab an agency shift from your agency app because you see 40 pounds per hour. The only thing that is driving you is the money, but you're not considering your safety. You're not considering your practice as a nurse. You're not considering your pain. Please, jumping from one nursing home to the other is not a good idea. I'm not talking about the hospital because I don't work in the hospital, but I'm telling you from experience what agency nurses have been through that I have seen working in the nursing home. Don't be jumping from place to place. Don't be jumping from place to place. If you have 5 nursing homes that you've been to, you're confident with the system, you understand the protocol, things seems to be similar in terms of policy, you can reach out to the managers when you need to in your shift, then it's better. Even if it's 2 shifts that you get in these 5 nursing homes in a month, my sister, know this and no peace. It is better you take those ones and have peace and eat that money without tearing up. So, because there's no point chasing money and we are picking shift. You pick shift here, you pick shift here, different nursing home, different location, travel 30 minutes, 45 minutes, 1 hour. In 2 months, in 3 months, you've been to 20 nursing homes. One day, monkey go market, no go return. No. So, I'm just telling you that. Make sure that you stick to the nursing homes that you know the policies and the protocols. It will save you a lot of hassle. Now, another thing I will advise you, and which probably might be the last one, is if you go into a nursing home and you have incidences and you have used your basic knowledge or as a nurse working in a different organization, which is not that nursing home, to deal with the situation and the resident is safe, especially when you're doing nights, in the morning, open up to the permanent staff that have come. I need to do this, but I can't find this document. I was supposed to do this, but I can't find this document. Or even use a plain sheet to do what you need to do and hand it over to them to say, I wanted to do this, but I don't know where you people keep this. This is what I want to do. I don't know where you keep this, but this is what I have done so far. This is where I've written it. They will appreciate that you know what you're doing. They will appreciate that you know what you're doing and take those documents and fix them where they're supposed to be. Because if you don't do it, it will be tagged so many things. It will be tagged so many things. So you need to be very careful when you're picking agency shift. Don't allow your quest for money make you take a decision that you'll regret. People who are very smart and who are very wise in this United Kingdom as nurses, they don't pick agency shift anywhere it comes from because they need the money. They pick it with sense. You got to pick it with sense so that you will have peace of mind at the end of the day. And that was supposed to be the last point, but I just remember something now. Finally, when you walk into any place as an agency and you feel that the environment is not conducive, you are not welcome, do not return there. A word is enough for the wise. Anywhere you enter and you feel you are not accepted, my dear, it's not your permanent job, it's an agency job. Tell your agency that you're not going back there to work. Don't return there for your own sanity, for your own mental health, to avoid issues. This is it, guys. I'll see you in my next video. And if you have not subscribed, subscribe to the channel. Subscribe to the channel, because in this channel we'll be talking a lot more on things that pertains to us as immigrants, nurses, so many other things. So subscribe and I'll see you in my next video. Bye.